Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to answer the question, how long does the pain last after knee replacement surgery? So the first thing to say, of course, is everyone is going to be different and everyone's going to heal and recover at their own rate and speed. But let's at least give you some general guidelines of what to expect, at least for the majority of people out there. There's going to be some outliers. Some people might have hardly any pain after knee replacement surgery, and some people might have intense pain, prolonged pain that lasts a very long time, unfortunately. But let's look at kind of the average overall. So the first few weeks, probably the 1 to 2 weeks after surgery, is that acute phase where you're going to have probably a lot of pain, a lot of swelling, and just a lot of symptoms in general. You're probably going to be managing this with some sort of prescription pain medicine, probably also might be taking Tylenol or something, acetaminophen. You may be taking an anti-inflammatory. And so you really have intense pain that is going to be important to manage through medication and other pain management strategies. After that, we move into the subacute phase. So that's probably the 4 to maybe 8 weeks after surgery. And in this phase, you're really starting to see, hopefully, for most people, a lot of improvements in range of motion, strength, and just general mobility and tolerance with different activities in your day-to-day life. But you're still going to have some pain. The pain is going to be fluctuating for most people, so you're going to have times where the pain is really intense, maybe after a physical therapy session sometimes, or when you do maybe a lot of walking or something like that. And then you might also probably have some times where the pain is very minimal and very manageable. But this is kind of where everything is kind of going from that change of the acute phase over to kind of the long-term management of your knee and body. So then probably after 8 weeks to 12 weeks is when we start to move away from kind of the rehab phase and the physical therapy phase of surgery. And of course, there's some people who may have less physical therapy. There's some people who may have more, longer physical therapy. But roughly speaking, maybe 12 weeks or so is when people start to wrap up their physical therapy, at least formally speaking, and just are managing their knee and their recovery on their own at this point. And this is when you really start to get that change and get that decline in your pain and in your symptoms. Now, also this is where you probably have the most variability. So there's some people who, after 12 weeks, you feel 50% recovered. There's some people who probably feel 90% recovered. Usually by 6 months, the vast majority of people will say that they feel fully recovered and back to normal. But there's people who will still experience pain and symptoms 1 year after surgery or even 2 years after surgery, and for a very small proportion of people, even longer than that. But for the vast majority of people, within that 6-month time frame is where you really start to get that decline. So you're getting a gradual decline. So it doesn't go where you have pain one day and you wake up the next morning and all your pain is relieved, all your symptoms are relieved, and you're a happy camper. It's more that gradual decline. So a decline in frequency, a decline in intensity of pain and symptoms, decline in intensity and duration of those symptoms. So all of that's gradually declining. Of course, you can still have times where you may have a spike and you may have an episode where the pain is increased, and that's perfectly okay and that's perfectly normal. Maybe you had a long day, you did a lot of walking or did a lot of activity, and the knee is just kind of saying, hey, I'm still here, I'm still healing and recovering, I'm getting better, but not necessarily 100% yet. And so really that's what you want to look for, is that gradual decline in the episodes of pain, in the duration and the intensity of pain. And you also want to look at your activity tolerance. So you'll notice that more and more, say the activity you like to do is walking, you'll notice you'll be able to walk a little further or a little bit faster or whatever it may be and still have that pain in a manageable level. So kind of the short answer to all of that is, how long does the pain last after surgery? It's going to vary. Expect it to last at least a few months, at least up to that 6 months period. Don't be surprised if you have some episodes of increased pain and episodes of maybe some increased frequency of pain even. But overall, there's going to be this gradual decline over the weeks and months after your surgery. And for most people, by 6 months, you should be 95 to 100% feeling good and not have any pain or symptoms. For some people, that may take a little bit longer, up to a year. And some people, it may even take up to a year and a half, 2 years to really get to that point of not having any pain at all. So thank you very much for watching. I hope this was useful and helpful. If you have any questions, be sure to leave them below. If you found this useful, I appreciate your likes, as that helps spread this video to other viewers. And always, please be sure to subscribe if you want to catch videos related to knee replacement surgery, all the frequently asked questions, advice, support, addressing your concerns, and everything else in between. Thank you for watching.